Now on to a more favorite topic discussion of mine, which is David Beckham's hair transplant. David Beckham is one of the most interesting celebrity hair restoration discussions, I would say, because the changes appear to be extremely subtle and over a very long period of time, I would say. And that is often where I find that the highest level of hair transplantation exists, not in the dramatic and immediate transformations, which are also extremely noticeable, by the way, but in maintenance and long-term planning. When analyzing David Beckham's earlier football years compared to more recent appearances, there are certainly periods where the frontal recessions and temple thinning were quite visible, particularly under harsh stadium lighting and the photograph shoots and with shorter hairstyles. But over the years, later photographs often show a much improved facial framing, stronger density throughout the frontal third. Again, David Beckham has not confirmed and publicly acknowledged having had surgery, and this improvement does not necessarily confirm him having had surgery, whereas hairstyling, lighting, hair fibers, medication, all sorts of photography angles, not the natural fluctuations in hair cycling can all influence the overall appearance and quite significantly. But however, looking at it from a strictly educational hair restoration perspective, David Beckham represents what myself and many surgeons would describe as a more conservative refinement pattern rather than an aggressive and immediate reconstruction. And that discussion, I would say, matters enormously. It's a result that I quite like and respect, and it's been done quite well with long-term planning in mind and quite conservative over the years with, I'm sure, quite a few refinements and as a staged procedure. One of the biggest misconceptions that patients have is believing that successful hair transplantation means lowering the hairline dramatically and at a young age. In reality, if we look at David Beckham's case and a lot of other elite celebrity work, we can see that the work was focused on preserving an age-appropriate hairline positioning, subtly reinforcing density, maintaining the natural temporal recession, and protecting long-term donor reserves. Very important and must not be forgotten. This is why Beckham's appearance remains believable in his 50s, and I'm sure it will further in life. The hairline does not appear excessively low. It still matures naturally with age. There is this still softness and irregularity in the frontal transition zone, and those details are critically important, and it allows for a shorter or longer hairstyle, use of products, use of combing, all sorts of let's say tricks that celebrities use and their hairstylists use. In fact, the more symmetrical and the more perfect a hairline appears, for me personally, it looks even more artificial and easier to spot. And often under close inspection and high definition cameras, for sure it's very difficult to hide, especially if you know what you're looking for. This becomes even more important for celebrities because they are consistently photographed from every imaginable angle, and an overly aggressive design will immediately become obvious. Then the whole speculation will start, articles will be written, and the whole media frenzy and so on. If some level of restoration was performed, then the approach appears to be restrained and, I think, strategically planned over time rather than created through one large and highly visible transformation, and quite possibly performed by the same clinic, the same surgeon. And that is increasingly how modern high-end hair restoration is approached, and especially among public figures, I found. The focus is no longer simply more grafts, immediate density, hairline lowering, immediate improvement in 12 to 18 months. Instead, surgeons start to think about level of future hair loss and progression, donor area preservation, facial aging, hairstyle flexibility, and how that particular result will look decades later. And I particularly like to emphasize the importance of donor area management and donor area preservation. Celebrities now often have access to highly experienced surgeons, large teams of technicians who understand the donor area supply is finite. Aggressive extraction at a young age should be avoided because it will most certainly create visible thinning years later, especially when the hairstyles become shorter. This is why ethical long-term planning matters far more than chasing immediate density. The best hair restoration work needs to remain almost undetectable and quite often invisible, especially to the overall population observing them. And David Beckham is such a strong example, in my opinion, of why subtlety frequently ages a lot better than dramatic transformation. Ultimately, the modern hair transplantation should not create a completely new person, and I strongly believe this, that it should quietly restore the balance of that certain individual while allowing the patient to continue looking like themselves. Simply, let's say, a fresher look, healthier look, and more confident over time. Personally, I consider the result that David Beckham has had over the years a very good one, age appropriate, not natural, subtle, and quite good model for somebody who is aiming for certain similar result. But important to remember that it was very well planned over a number of years and most likely with staged procedures, and this long-term planning was always kept in mind.